Hi, this is Dr. Paul, and thank you so much for tuning into this video from Waterfront Dentistry by Paul's. So today I'd like to talk to you about what happens when you don't have enough bone to have implants or to have implants inserted. So let's talk about the more extensive bone grafting needs or necessities. So the first thing is the sinus lift procedure. So all of us house these big bags of air over our second premolar, first molar, and second molar called the maxillary sinuses. Now, this sinus is a dead bag of air that actually helps us have resonance with our voices, and that's pretty much all it does. And also to some extent regulate temperature. Now, when you need to have implants placed again in the second premolar area, the first molar area, or the second molar area, and if you had bone or tooth missing there for a long time, your sinuses actually get larger in that now when you need to stick or insert an implant of a certain dimension, steady dimension, almost 12 millimeters, you might not have enough of bone width-wise and even depth-wise to house the implant. So in a situation like this, a dental surgeon might tell you, look, you need to have something called a sinus lift procedure. So there are two kinds of sinus lift procedures. One is the direct lift and the second is the indirect lift. So the indirect lift is called the Cadwell loop, and what that basically involves is a surgical procedure where a part of your vestibule is surgically entered. The sinus has a Schneiderian membrane which is peeled off of your the bone area with certain instruments, and then you place certain kinds of bone, which is usually allograft with a little bit of autograft, which is cadaver bone and a mixture of your bone with the cadaver bone and some antibiotics, and then you need to let that area heal from anywhere from 6 to 9 months to then go in to place an implant. So that's called the indirect bone indirect sinus lift. Direct sinus lift is a little easier or a little more manageable, and what that basically involves is having at least 5 millimeters of bony depth between the ridge and the floor of your sinus. So the cutoff that determines whether we're going with the direct sinus lift or the indirect sinus lift is the presence of 5 millimeters of bone. So with the direct sinus lift, we drill osteotomies or holes into the area where the implant is going to be inserted, and then using these special osteotomes or instruments, we tap bone graft material into the sinus, sandwiching it between the bone and the Schneiderian membrane, and then waiting for 6 to 9 months, we lodge implants in there, or we can actually lodge implants in there at the same time. It all depends on if we have enough primary stability or initial torque value of the implant. So this is very important to realize that with the upper jaw, we can either go with the direct or the indirect sinus lift technique. So now this is in the area of the sinuses. The other areas are conventional to whether it be the upper jaw or the lower jaw, and you have situations or instances where surgeries have to be done to increase the bony volume. So there are bony materials like block grafts or bone onlays or even certain kinds of meshes that actually hold on to the volume of bone needed to passively have soft tissue go over and suture. In certain cases, we even use intermaxillary or interbony fixation screws and certain kinds of bone morphogenic protein liquids with collagen filaments or fibers to help the body accelerate healing and have the graft and the host take. So these are all fairly extensive, invasive, and expensive procedures, and this is why we would rather you think about having implants placed either at the time of extraction or within a year if we do bone grafting or ridge grafting in the immediate extraction period. So very important to realize that when a tooth is taken out, if we have access to a cone beam CT or if we see that you have enough bone, if we place an implant in, you actually save a lot of bone morbidity later on in life. I hope this has answered a couple of your questions regarding, what is ridge augmentation, what is, extensive bone grafting. Now, if you have any questions or comments, you can always reach out to my staff and I, and we would love to help you out. Thank you so much for watching.